Alright, welcome to the Pharmacology lecture in the Crushing the Preclinical Years course. So the outline of this lecture will be how to study pharmacology in medical school, the basic premise of you need to understand it and then memorize it, some great resources, and ultimately kind of what I did to understand pharmacology. So let's get to it. So how to study pharm. The best way to study pharmacology in med school is to know the mechanism of action. Okay, and then once you know the mechanism of action, you can group all the drugs based on that. So then you kind of put the ACE inhibitors and the ARBs together. You can put beta blockers together, and on that same token, you can put the alpha blockers with the beta blockers, because if you understand beta receptors, you understand alpha receptors, and then that's such an easy way to do it. If you know the mechanism of action of a drug, you put all those drugs in the same class based on the mechanism of action, and then you just remember the basic kind of prefix and suffix of those drugs based on the mechanism of action, and you'll remember them. That's such a simple way to do it. And then another way to think of it too is understand how it's changing the physiology. Okay, with medications, I once had a pharmacology instructor that told me that with the meds, you're basically just poking the normal physiology. So if you think of lisinopril here, let's talk that. Okay, so an ACE inhibitor, lisinopril. ACE inhibitors prevent the production of angiotensin II. Okay, angiotensin II goes and it constricts blood vessels and a few other things and whatnot. But there's an enzyme called the angiotensin converting enzyme, or ACE, and that's what converts angiotensin 1 to angiotensin 2. And the ACE inhibitors, they inhibit ACE. Okay, so any of the medicines that end in pril, right, this suffix here, pril, they're ACE inhibitors. So you have lisinopril and enalapril, and there's a few others that I can't think of off the top of my head, but those are the two that I can think of. Those all inhibit ACE. And then you have the angiotensin receptor blockers like losartan, olmesartan. Those ones actually just block the receptor of angiotensin II, so they don't inhibit the production of it like the ACE inhibitors do. They just block the production, or block the receptor. So those two things essentially work on kind of the same physiologic pathway in different spots, and so it's easy to kind of lump them together and understand the side effects, the downstream effects, the kind of physiology is the same principle. So a lot of people will just try to memorize pharmacology, and you can probably do that and you can get by. There's some people in my medical school class that did that, and they made it through, right? But they don't know the mechanism of action like they should, and so it leads to lower board scores. It leads to lower block exam scores, because memorizing in med school will get you by decently. But if you understand and you can synthesize material, and you can extract material from a question and try to figure out what they're saying and where they're going with that certain topic, and really kind of think through something based on the physiology, then you're going to be leaps and bounds ahead of the people that just simply memorize. So when you want to know the mechanism of action, you want to know what happens because of it, and you want to know why it happens. Like we talked about ACE inhibitors. Okay, you want to know what happens to that ACE inhibitor prevents the production of angiotensin 1 to angiotensin 2, and then because of that, it prevents renal artery constriction. It prevents other peripheral blood vessel constriction. And then it can cause high potassium. It can cause acute kidney changes, so you can get a little bit of decreased perfusion, a bump in the BUN creatinine of the kidneys initially. These are the things to know about the medicine, what it's doing, and then the kind of the downstream effects of that. And then you can memorize the finer details. So the finer details come in like sketchy pharmacology, okay? But if you understand the mechanism of action, you understand the physiology, then you can go watch sketchy and get those finer details and get those few points here and there. But understanding the mechanism of action, the pharmacology, the physiology, all that good stuff will make you so intelligent that you'll do so much better on step one, and you won't worry about doing well on step one because you learned it the right way from the start. So there was a memorizer in my class. All he did was just Anki Dex. He didn't do anything else. All he wanted to do was just Anki Dex. He didn't want to watch board review videos. He didn't want to look at the lectures. He didn't want to read any books. And it's understandable, right? Doing Anki Dex is pretty easy. You go through them and you feel good about them. It's got the spaced repetition built into it. It's a great idea, right? It seems like a great idea on paper. Well, he did that. He ignored doing anything else, really. Just did Anki Dex and practice questions. And he did okay, passed his classes, but he could not do well on boards. He just couldn't. He did just downright average, and he had huge aspirations in terms of what kind of doctor he wanted to be, and he had to do very well on boards to be that kind of doctor. And at the end of the day, he was not able to accomplish that because he focused simply on memorizing. Okay, and he was much smarter than me. Okay, but he scored 20 to 30 points lower than me on the USMLE Step 1 because he focused on memorizing. I didn't focus on memorizing, I focused on understanding, and then I watched Sketchy to memorize those finer details. So that's just one example, but it's pretty clear that if you focus on memorizing, you're going to miss some important things there, and some important things that come with practicing medicine too, because when you practice medicine, nothing's like the textbook, right? It's not just memorizing something. You have to think about what's going on, think about the physiologic changes, and try to come up with a diagnosis and try to understand the treatment that would work for them based on that. So there's a lot more than just memorizing in medicine, and I think it starts with understanding things at the basic physiologic and pharmacologic level when you're still in med school. So these are the resources I used. These are incredibly difficult to come by, these Kaplan Pharm videos. We'll talk about those in a second. I really like First Aid for Pharmacology because it lumps those drugs together, puts them in nice tables, so I would highly recommend you get that. Boards and Beyond is great. Not absolutely essential for Pharm, but it's a good option. Practice questions, practice questions, practice questions. I'll drill that one into you by the end of this course. That's so important. You need to do practice questions throughout med school. And then Sketchy Pharm for those finer details. So Kaplan Pharm videos, these are the ones, I'm sorry, I don't know if this is crude or mean or not, but there's a French guy that teaches, I can't remember his name for the life of me. He teaches some great pharmacology videos. If you can find those, just Google them, see if you can find the file of them somewhere, because they're old videos. They're not the active ones that Kaplan uses. So I would Google them, see if you can get on Reddit, Student Doctor Network, see if somebody's got a file to them, because those are fantastic. If you can find them, use them. He just simplifies the concepts and explains them so nicely. The downside to this is, since it's not really a video program, there's no notes, so you just got to take your own notes, which it's not too hard to do. But these videos will make a huge difference for you. So just Google them, try to get on Student Doctor, or SDN and Reddit, and see if there's anybody that has a file with them. Ask the people at your school. I don't have the file with them, otherwise I'd share it with you. They're incredible videos, and I wish that Kaplan would have kept them on their course, because they're fantastic. And then First Aid. This is a fantastic resource for Pharm. I'm not a huge fan of First Aid for other things, but for pharmacology it really categorizes and lumps the drugs together pretty well. So after you watch some other videos and things and you start to understand the medications, it's so easy to go here and kind of memorize the finer details. This, along with Sketchy, will really help you kind of remember things that you need to remember. And it's also an awesome way to continually refresh your mind, because it's laid out in such a simplified, easy format to just go in and look at real quick. You can easily remember what the mechanism of action is, what the biggest side effects of medications are, and kind of what other drugs are in that class. So if you look at lisinopril, it'll list out all the other ones that are also in that class, and so it's pretty easy to see everything that you need to know in a nice simplified way. I highly recommend that you get First Aid and that you go over pharmacology in First Aid. Boards and Beyond, it's a fantastic all-around resource, and you're probably going to have it for the physiology and all the other things. He does a great job of explaining pharmacology from a physician standpoint. I don't really feel like, as far as pharmacology goes, this is an essential resource for it, but you'll likely have it anyways, because you'll be using it for other things like pathology and physiology. So if you have the time, you could watch the pharmacology videos. Not an absolutely necessary one, though. And then practice questions. You can start doing these right after first year. So do a practice question. You can in your dashboard, I guess, of the practice question database, you can select that you just want to do pharmacology questions. And so that's a nice way to do this after a pharmacology class when it's over. You can go in there, select pharmacology, do those questions. And after you do those questions, then you annotate that into First Aid. I've said this a few times before. Do a question, annotate the high points into First Aid. Okay, and then when you go back to First Aid, you have not only the bulleted information, but you have some nice details from some practice questions. And so a lot of people will say, oh, don't do any practice questions until second year or so. But if you start doing these after you take pharmacology in first year, you'll be so much more comfortable with those questions. And pharmacology is kind of one of the big three topics on the USMLE and the COMLEX. It is, pharmacology, physiology, and pathology. If you get those three, you're going to do good. You're going to do just fine. And so the earlier you can start knocking out pharmacology questions and start understanding how test writers and question writers ask questions based on these drugs, the sooner that you'll have a bigger base of knowledge, and you can grow that knowledge throughout second year and really start to focus on um, pathophysiology in second year. And the same principle applies for physiology here. Once you are finished with that course, you can start doing these questions as well. And I realize right here that I didn't change that. I just put physiology questions. So you can do pharmacology questions, is what I meant to write there. Or you can do physiology as well. So both those classes are typically taught in the first year, and you should be able to do both of those at the end of first year. Do some questions with both of those. So Sketchy Pharm, I really like Sketchy Pharm. I don't like it if it's the only resource you use. It's a fantastic way to memorize the details. Clinical application of it, if you just depend on Sketchy, the clinical application is not going to be as great, but it's a fantastic way to memorize. So what I always say, just you need to learn things first and then Sketchy later, okay? Go and make sure you understand the mechanism, make sure you understand what's happening downstream with the side effects of that medicine and the mechanism, and then after you understand that, go Sketchy it, and then you'll get the finer details that are important for test day. So in summary, follow the things that I mentioned here. You can add some Anki or Anki, however you say it. If anybody has a preference of that, I guess just let me know in the comments. If you want to add Anki, you can. And then take the time with pharmacology. Okay, pharmacology, like I said, is kind of one of those big three in medicine and for the step 1 and level 1. If you take the time on it, you'll learn it well. So, basic outline of what I recommend: learn it well in class. Watch those videos, the Kaplan ones if you can find them. If you can't, watch Boards and Beyond. If you don't want to watch Boards and Beyond, memorize the stuff out of first aid, and then kind of throw in Anki as you see fit. And once you get a good understanding of the class of medicines, what they're doing mechanistic wise, and then what the side effects downstream of that mechanism are, then you go and you watch some Sketchy Pharm and you understand the basics. So understand first, Sketchy later, and you'll get a lot of points on test day if you follow that outline. So we'll see you in the next video.